So today we are going to discuss the last set of question discussion. So today is the last live class for this batch. Okay. So first
Okay.
question is, a new drug that has excellent effect in decreasing death rate associated with highly fatal disease. How will that drug affect the disease rate? That is, the new drug is decreasing the death rate. So how it is affecting the disease rate? A, prevalence will be increased. B, prevalence will be decreased. C, incidence will be decreased. D, incidence will be increased. If a drug that is decreasing the death rate means, what is the effect?
Prevalence, ma'am?
Yes, prevalence is affected. Is it increasing or decreasing?
Decreasing.
Prevalence is decreasing. What is prevalence? Prevalence means
Numbers, ma'am.
total number of existing cases. That is prevalence. So,
Yes,
if
ma'am.
the death rate is decreasing means what will happen? That means more patients are existing in the disease cases. They are not having death. Instead of death, they are continuing their condition with the disease condition. So that will increase the prevalence. Prevalence means new cases plus existing cases. So if death is not occurring and patients are living with the disease condition, that will increase the number of existing cases. Okay. So if prevalence is decreased, how prevalence will be decreased? If death rate is increasing, what will happen? That some patients will dead, and if the death is occurring, that will reduce the number of existing cases. So prevalence will be decreased. But here death rate is decreasing. That means more number of patients are living with the disease condition. That will increase the prevalence. What is incidence? Incidence is new cases. Occurrence of new diseases is called incidence. Here, incidence is not affected because incidence is new cases. In case of decreasing the death rate, that is existing in the existing cases, that is belonging to the patient who is already having the disease condition, not the new cases. So this condition, only the prevalence will be affecting and the prevalence will be increased, not incidence is affecting. Okay, so here prevalence is affecting, so you have to find whether it is increased or decreasing. The prevalence is increasing, whether there is decrease in death rate. If the death rate is increasing, at that time prevalence will be decreased. Next question, a patient with clozapine for depression is recently diagnosed with diabetes. Doctor wants to change clozapine. What is the most appropriate drug? Olanzapine, quetiapine, aripiprazole. Which one the doctor can choose for a patient with diabetes?
Option A, ma'am, same group.
No, this olanzapine is causing metabolic side effect like weight gain, insulin resistant, hyperglycemia. These are the metabolic side effect of
Option C.
Yes, option C is the correct answer. So metabolic side effect is the this olanzapine, quetiapine, and clozapine is having more risk of metabolic side effect. They are more having metabolic side effects like insulin resistance and hyperglycemia and weight gain. So it is not suitable for patient with diabetes. Okay, so aripiprazole, it is having lower risk of metabolic side effect, so it can be safely given. So here option C, aripiprazole, is the correct answer. Next question, which of the following bacteria involved in the development of dental caries? Streptococcus mutans, Listeria monocytogenes, Yersinia pestis, Corynebacterium diphtheria.
Option B.
Yes, option A, Streptococcus mutans are the correct answer. So it is the causative organism of dental caries. What about Listeria monocytogenes? It is causing which condition? Listeriosis. Listeriosis is caused by Listeria monocytogenes. It is a foodborne infection. Okay. And Yersinia pestis cause plague. Yersinia pestis cause plague. And Corynebacterium diphtheria, it is causing diphtheria. Next question. Acute heart failure patient with shortness of breath, peripheral edema, low blood pressure, and cold extremities. Which Forrester classification is this? Dry and cold, wet and cold, dry and warm, wet and warm. So this is about Forrester classification. Okay. Forrester classification is used to categorize the patients with acute heart failure based on the cardiac output and systemic vascular resistance. Okay. So we can categorize the patient into 4. That is, this is the Forrester classification. 4 classes are there: class 1, class 2, class 3 and class 4. Class 1 is warm and dry. Class 2 is warm and wet. Class 3 cold and dry. Class 4 cold and wet. Okay, so this classification is based on the patient's perfusion, whether the blood flow is proper for the patient or not. So perfusion, the patient's whether the patient is having cardiogenic shock, or what is the condition of the patient's lungs. Is there any pulmonary edema or by looking all these factors, we can categorize this patient based on this Forrester classification. Okay. So class 1, it is warm and dry. Warm means you have to study what does this warm, dry, wet, cold represent. Okay. Warm means well perfused. Proper blood flow is there. Dry means dry lungs. There is no congestion. Okay. And wet means there is congestion. That is wet. Or pulmonary edema is there. That is wet condition. And cold means there is cardiogenic shock. That is warm, dry, wet and cold. So here warm and dry means the patient is having well perfused. That means warm extremities, proper urine output is there, renal functions are okay, normal sodium levels. So means the condition. So that is warm. And dry means dry lungs. There is no congestion. Okay. So warm and dry means the patients will be having well perfused condition and there is no congestion. That is warm and dry. And when class 2, it is warm and wet. Warm means again well perfused condition, and wet means there is pulmonary edema or dyspnea. Shortness of breath will be there. That is warm means cold and dry. Cold and dry. Cold means there is cardiogenic shock. That is, the patient will be having cold extremities because of poor perfusion. The patient will be having, the urine output will be low and renal failure will be there, and sodium level will be having hyponatremia. So these all conditions can indicate cardiogenic shock that represent cold. Okay. And dry means is cold and wet means there is cardiogenic shock and there is pulmonary edema. Okay, so the mortality death rate is 51% for the class 4. So here in the question there is shortness of breath, peripheral edema, low blood pressure, cold extremities. So in which class the patient will belongs? Shortness of breath and edema will represent which condition? Cold, wet, dry or warm?
Dry.
Hello? Shortness of breath and edema.
Dry and cold.
Dry, we have already discussed here. Pulmonary edema, shortness of breath. Dyspnea means shortness of breath. Okay. So shortness of breath, it belongs to wet. If there is any congestion, shortness of breath or edema, that means it is wet condition. Okay. So here wet will be there because there is shortness of breath. So wet will be there. Wet and low blood pressure, cold extremities, that represent which condition?
Wet and cold, ma'am.
Cold.
Yes.
Wet and cold.
Wet and cold. Cold, that is low blood pressure, cold extremities, low urine output, renal function is not normal. That all indicate the patient is cold. And shortness of breath or peripheral edema or pulmonary edema and congestion, that all represent the patient is having wet condition. Okay, so here option B, wet and cold, is the correct answer. Okay. So if in the question this low blood pressure and cold extremities is not given, only shortness of breath and edema is given, at that time we can choose this warm and wet. Okay. if shortness of breath and edema is only given in the question, no low blood pressure and cold extremities, we can choose wet and warm, because in this condition, the shortness of breath or congestion is more. So we can choose the answer as wet and warm. Okay, if any symptoms or any condition that is related to cardiogenic shock is given, we can choose cold. Next question, what is the main method of transmission of Brucella species? Airborne, blood transfusion, contact with the infected person, ingestion of unpasteurized milk or milk product.
Option D, ma'am.
Option D, ingestion of unpasteurized milk is the mode of transmission of brucellosis. Brucella species can cause brucellosis. That is, the method of transmission is ingestion of unpasteurized milk or milk products. Okay. So, if there is any symptoms of brucellosis, you should not give OTC medicines to the patient. Instead of that, you have to refer the patient to the hospital. Okay. This is another question. The patient is having brucella and the symptoms are there, and what is the best action at that time? If there is any symptoms of brucellosis, the symptoms are fever, chill, loss of appetite, weakness, joint pain. These are the symptoms of brucellosis. If there is any symptoms, you should not give OTC medicines. You have to refer the patient to the hospital. For treatment of brucellosis, we are giving antibiotics. Okay. So the drug regimen is doxycycline 100 mg per oral BD for 6 weeks plus rifampicin 600 to 900 mg per day per oral for 6 weeks, or otherwise we can use doxycycline 100 mg per oral BD for 6 weeks plus streptomycin 1 gram per day intramuscular daily for 3 weeks. This is the drug regimen for treating brucellosis. So if there is any symptoms, you have to refer the patient to the hospital for taking antibiotics. You should not give OTC medicines. Next question, a patient who is taking PDE5 inhibitor, phosphodiesterase enzyme 5 inhibitors for erectile dysfunction is diagnosed with angina. Which of the following anti-anginal medication would be particular concern in this patient? Metoprolol, diltiazem, amlodipine, nitroglycerin. Which one is having particular concern? Which one should not be given together?
Nitroglycerin.
Yes, nitroglycerin. What is the reason? These PDE5 inhibitors are causing vasodilation. Nitroglycerin is also causing vasodilation. So there will be the synergistic effect. Severe hypotension will be there. So you should not give any other vasodilator with these PDE5 inhibitors. So nitroglycerin is the drug that is having particular concern. You should not give that together. It will cause severe hypotension. Okay, so what are the drugs that is used for erectile dysfunction? PDE5 inhibitors used for erectile dysfunction. Sildenafil that is given for erectile dysfunction. Next question, an 18-year-old male is diagnosed with Chagas disease. Which medication would be the best for this patient? Nifutimox, Suramin, sodium stibogluconate, metronidazole. The treatment for Chagas disease. Chagas disease is a protozoal disease that is caused by Trypanosoma cruzi, and it is transmitted by the bite of infected bug. Kissing bug is causing this Chagas disease. It is a protozoal disease. So for treating this Chagas disease, the drug is option A, Nifutimox.
Yes,
Okay. So Chagas disease, it is also called South American trypanosomiasis. Okay. Chagas disease is South American trypanosomiasis. The drug used is Nifutimox. And this Suramin. Suramin is used for treating the African trypanosomiasis. African trypanosomiasis. It is also called sleeping sickness. Sleeping sickness. Okay. So for treating this sleeping sickness, we are using this Suramin. Okay. And sodium stibogluconate. It is used for treating which condition? Leishmaniasis. Okay. Leishmaniasis is treated by sodium stibogluconate. And metronidazole is
for
antiprotozoal.
anaerobic infections.
Anthelmetics.
Yes.
Anaerobics also.
Yeah. Which of the following laboratory finding is characteristic of hemolytic anemia? low reticulocyte count, high ferritin, elevated bilirubin. What is the laboratory finding for hemolytic anemia?
Option A.
Option A, low reticulocyte. In hemolytic anemia, there is low reticulocyte or high reticulocyte. Actually, for hemolytic anemia, there will be high reticulocyte. Here the answer is elevated bilirubin. Okay, unconjugated bilirubin will be elevated in case of hemolytic anemia. Hemolytic anemia means what? The RBC is destroyed prematurely. Okay, prematurely the RBCs are destroying. So the bilirubin, it is the byproduct of breakdown of hemoglobin from the destroyed RBC. So if more RBCs are destroying, there will be more bilirubin as the byproduct. So in hemolytic anemia, the bilirubin will be increased. Okay, so the laboratory finding for identifying hemolytic anemia, there will be elevated level of bilirubin. And in case of reticulocyte, these reticulocytes are immature RBC. Okay, so in case of hemolytic anemia, there will be high reticulocyte. Low reticulocytes are mainly for bone marrow failure conditions or deficiency anemias. Iron deficiency, folic acid deficiency, vitamin will be that condition. There will be low reticulocyte. For hemolytic anemia, there is high reticulocyte. Next question. A patient is about to undergo 3 cycles of chemotherapy prior to the surgery for bladder cancer. Which of the following best describe chemotherapy in this state? Adjuvant, neoadjuvant, palliative, maintenance. 3 cycles of chemotherapy prior to the surgery. What is this chemotherapy? What type?
Palliative.
Actually, it is neoadjuvant. Neoadjuvant chemotherapy. Okay. So we are having different types of chemotherapy. That is adjuvant. So adjuvant chemotherapy means it is used as a supplemental treatment to attack the micrometastasis following surgery and radiation treatment. So after the surgery or radiation treatment, we are giving this adjuvant chemotherapy as a supplemental treatment. So after the surgery or after the radiation treatment, we are giving this adjuvant chemotherapy as a supplemental treatment. So that is adjuvant chemotherapy. After surgery, we are giving. Neoadjuvant chemotherapy means it is given prior to the surgical procedures in order to shrink the cancer cell. So in order to shrink the cancer cell prior to the surgical procedure, we are giving neoadjuvant chemotherapy. So here in the question, they have given 3 cycles of chemotherapy prior to the surgery of bladder cancer. So this is neoadjuvant chemotherapy. Okay, prior to the surgery is neoadjuvant. After surgery, as a supplemental treatment, it is adjuvant chemotherapy. And maintenance chemotherapy means it is given in lower doses to assist in prolonging condition is known as maintenance chemotherapy. So for long-term maintenance, we are giving low doses of drug, that is maintenance chemotherapy. So in order to prevent the cancer to attack again, we are giving lower doses of the drug in order to maintain the therapy, that is maintenance chemotherapy. Okay. And last one, palliative chemotherapy means it is indicated when neoplasms are disseminated and are not amenable to the surgery. So for last stage cancer, so for the last stage of cancer, sometimes the surgery will not be will not cure the patient's condition. So no other treatment is better for the patient. So for the improving their supplement as palliative therapy, we are giving palliative therapy. That means mainly this main aim of this palliative chemotherapy is relieving the symptoms, and we can improve the quality of life and manage the symptoms when cure is not possible. For last stage of cancer, there is no cure. So if there is no cure is possible, we can improve the patient's symptoms. For that, we are giving palliative chemotherapy. Okay, no surgeries is not possible for that patient. So we are just improving the symptoms by giving palliative chemotherapy. Okay, so these are the 4 types of chemotherapies. So here the answer is neoadjuvant chemotherapy. Clear?
Yes, ma'am.
Next question, which is the best time to take leprost? In the morning after breakfast, in the afternoon before dinner, in the evening before bed, at any time during the day. What is latanoprost? For what it is used?
Is it
Latanoprost.
insulin, ma'am?
Which one?
Insulin?
No. It is not. It is a
No.
prostaglandin analog. It is used for treating glaucoma. Okay. In order to reduce the intraocular pressure, we are taking this prostaglandin analog, that is latanoprost. So for the treatment of glaucoma. So what is the best time to take this latanoprost? The brand name is Salatan.
Ma'am, evening time or before bed?
Yes, in the evening before bed. That is the correct answer. The Salatan, it is always taken at night before bed because this intraocular pressure is peak night. At time, the intraocular pressure will be at peak. So you have to reduce that intraocular pressure. So for that, we are taking latanoprost at the night time. Okay, in the evening before bed. At that time, there is a chance for increasing intraocular pressure. So for reducing that intraocular pressure, we are taking latanoprost at the night time before bed. Okay, so this is Salatan is the brand name. That is latanoprost that is used for the treatment of glaucoma. And the dose is 1 drop QHS. 1 drop every night will reduce the intraocular pressure and will be used for treating glaucoma. Next question. A 68-year-old patient with cardiac failure is diagnosed with ovarian cancer. She begins using cisplatin but becomes nauseous and suffer from severe vomiting. Which of the following medication would be most effective to counteract the emesis in this patient without exacerbating her cardiac problem? So the patient is having cardiac failure. She is taking cisplatin and she is having vomiting. So which antiemetic drug is safe, that is not worsening her cardiac condition, cardiac problem? Droperidol, prochlorperazine, or that is not affecting the heart.
Option B. Ma'am,
Option?
Palanocetra?
Yes,
Uh,
option D.
option C, ma'am.
Yes, option D, palanosatron is the correct answer. So, for treating the cisplatin or chemotherapy induced vomiting, we can use this 5-HT3 and this among this 5-HT3 antagonist, palanosatron is having high hematogenic activity and it does not affect the heart. So for a patient with cardiac failure, they can safely use palanosatron. Other 5-HT3 antagonists like ondansetron, it is affecting the heart. It is causing QT prolongation risk. So it is not safe for a patient with cardiac failure. The palanosatron is safe. All these three drugs will affect the heart and it is not safe. Next question, which single nucleotide polymorphism causes abrupt stop codon? Non-synonymous nonsense, non-synonymous missense, synonymous missense, nonsense missense. Which SNP can cause stop codon? Formation of stop codon.
Option D.
A is the correct answer. Non-synonymous nonsense is the correct answer. So what is SNP? Single nucleotide polymorphism. This is the variation of single nucleotide in a DNA sequence. So that variation can change the protein and that mutation can cause, sometimes that can form stop codon. Okay, stop codon means GA. These are the stop codons. So any single nucleotide change can cause mutation and it can sometimes form stop codon. That stop codon, if stop codons are formed, it will stop the protein synthesis. So we will get incomplete or shortened protein that will cause various disease condition. So it can stop the shortened or incomplete protein that is causing various type of disease conditions. So the SNP that are causing stop codon is non-synonymous nonsense. So here you have to know what is non-synonymous, what is nonsense, what is synonymous, what is missense. Okay, so nonsense mutation means any mutation that result in stop codon. If any stop codon is forming, that is a nonsense mutation. Okay. And missense mutation means the mutation that will change the protein. If only the change in protein is there, that is missense mutation. No formation of stop codon, only the protein change is there. It is missense mutation. And non-synonymous mutation means that mutation will alter the amino acid. If there is any alteration in amino acid, that is non-synonymous mutation. And synonymous mutation is silent mutation. There is no alteration in amino acid. It is a silent mutation. There will be no alteration in amino acid. Okay. So if stop codon is forming, that is nonsense mutation, and that will alter the amino acid. So that is why it is non-synonymous nonsense. Okay. So non-synonymous means alteration of amino acid. Synonymous means silent mutation. There is no alteration in the amino acid. Nonsense mutation means stop codon formation. Missense mutation means change in protein. Is that
Yes, ma'am.
clear? Okay. So what is the central dogma? DNA to RNA to protein. That is central dogma. Okay. So DNA itself, it will be replicating. DNA to RNA is called what? Translation or transcription. DNA to RNA. It is transcription. Okay. And RNA to protein, it is translation. Okay. And RNA to DNA is RNA is transcription. RNA to DNA is reverse transcription, and RNA to protein is translation. Okay, so this is central dogma. Next one. A patient is taking too much medication, that is amlodipine, lisinopril, prednisolone, and patient developed insomnia. What is the best for her? A. Stop taking prednisolone. B. Take prednisolone in the morning. C. Switch to valsartan. What is the best advice? The patient is developing insomnia. Option B. Take prednisolone in the morning is the correct answer. Because these corticosteroids, that will disrupt the sleep pattern. Okay, it will increase the alertness, and to reduce the side effect, we have to take the medication in the morning. If it is taken in the night, it will alter the sleep pattern and it can cause insomnia. So in order to reduce this insomnia side effect, we have to take prednisolone in the morning. So it will reduce the side effect of insomnia. Okay, so no need to stop the prednisolone, just change the time of administration. You have to take it in the morning, so it will be reducing the side effect of insomnia. Next question. A 27-year-old pregnant woman has been recently diagnosed with iron deficiency anemia. Her hemoglobin level is less than 11 grams per deciliter. What would be recommended? A. Ferrous sulfate tablet with a cup of tea. B. Ferrous sulfate tablet on empty stomach. C. Ferrous sulfate tablet with antacid. D. Ferrous sulfate tablet. Which one is recommended? B or D?
D. Empty stomach, it will cause gastritis.
On empty stomach, the iron absorption is more. Acidic pH, HCl, vitamin C, acidic pH, that all will increase the iron absorption. So on empty stomach, or actually option B is the correct answer. On empty stomach, these iron supplements are having more absorption. So on empty stomach, the iron absorption is more, and the acidic pH, the HCl, vitamin C, that all will increase iron absorption. So it is better on empty stomach. And when option Gcc, the is taken with cup of tea or antacid. It is not.
Ma'am, voice is breaking.
Okay. So on empty stomach, the ion absorption is more. With cup of tea with antacid, the ion absorption are decreasing. And for normally for the treatment of iron deficiency anemia, we are giving regular iron supplements. Slow release tablets will reduce the absorption and it is less effective in iron deficiency anemia. So among these four options, option B on empty stomach is the correct answer. In the chapter hematinic, in the live class hematinic, we have discussed which all factors are increasing and decreasing the iron absorption. So you can just see that the empty stomach absorption. So that is the best recommended here. Next question, which he has been taking for 1 year. A week ago, he had an infection and was prescribed linezolid. Was breathing rapidly and started to sweat and developed and noticeably shaking. Which of the following name of this drug-drug interaction happened to this patient? So what are citalopram and linezolid? So what is the interaction? Hepatotoxicity, C-activity, serotonin syndrome, Stevens-Johnson. Which one is the answer?
Ma'am, serotonin syndrome.
Yes, serotonin syndrome is the correct answer because there is this serotonin syndrome means excessive serotonin in the brain. That is serotonin syndrome. So citalopram, it is an antidepressant drug, that is selective serotonin reuptake inhibitor. So as the mechanism of citalopram, it will increase the serotonin level. Okay, and this linezolid, it is an antibiotic and it is a reversible inhibitor of MAO. Okay, so linezolid is a MAO inhibitor. Okay, so MAO, monoamino oxidase, is mainly responsible for the breakdown of serotonin. So if that enzyme is inhibited, there will be no breakdown of serotonin. Serotonin level will be increased. So as a result, there will be serotonin syndrome. So citalopram is increasing the serotonin level and this linezolid, by inhibiting MAO enzyme, it is increasing the serotonin level. As a result, there will be excessive serotonin in the brain. That is serotonin syndrome will be there. Okay. So you should know that the linezolid is also having the mechanism of inhibition of MAO enzyme. So this is the correct answer is serotonin syndrome. Clear?
Yes, ma'am.
Next question, a case about fresh pharmacist work in a community pharmacy and customer asks why cosmetic products is expensive. Then the pharmacist say our products are good brand, not counterfeit. What is this type of communication? Assertive, passive, professional, aggressive. If any customer asks why the products are expensive, you told them that our products are good brand, not counterfeit. What is this type of communication?
Looks aggressive, ma'am.
Not aggressive. They just say our products are good brand, not counterfeit. It is not an aggressive. Actually, it is assertive. Okay. So different type of communication. Assertive means you thoughts, feelings, and belief in an open, honest, and respectful way. If we are in a respectful way, that is as the assertive communication. Here, the customer asks why the cosmetic products are expensive. So they just they just said that our products are good brand, not counterfeit. That is, they are expressing their thought in a honest, open, and respectful way. That is assertive communication. Passive communication means avoiding the issue. If we are avoiding the issue or not expressing one's thought clearly, that is passive communication. For the same condition, if the pharmacist is not answering the question of this customer and they are not focusing on this customer, that means it is passive. If they are avoiding the question, it is passive communication. And aggressive communication means being rude or disrespectful. Okay. If we are this is our product. If you don't want, you can go to other pharmacy and buy. Like that, we are talking it is aggressive communication. So if we are rude or if we are expressing our thought disrespectfully, it is aggressive communication. And professional communication means it is more appropriate for a work setting. That is, we are explaining the use of each and every component of that product and explaining the details of the product. For that reason, the product is explained like that, giving the reply. That means it is professional communication. Okay. So here they just say that the products are good brand, not counterfeit. That is, it is an assertive communication. Okay. And another question was based on this type of communication that a physician shouted at the pharmacist for a the pharmacist didn't respond. Say calm, the pharmacist say calm there. So what type of the communication is pharmacist following? Assertive, passive aggression, or professional? If the pharmacist stay calm, what will be the pharmacist way of communication?
This means ignoring the
Pharmacist,
answer, ma'am. Okay.
yes, that physician is shouting at the pharmacist, but pharmacist
Yes.
is staying calm. He is not replying. He is only staying calm. That is, he is
Professional,
avoiding the
ma'am.
issue.
Should be
Which
professional.
one?
Professional C.
No, it is passive.
Passive.
Not responding or staying calm means it is passive. Okay, passive means avoiding the issue or not
Yes,
expressing
ma'am.
one's thought clear. Passive communication. Next is the characteristic for facultative anaerobe. A only grow anaerobically. B only grow in the presence of oxygen. Organisms that can grow in both presence and absence of oxygen. D require simultaneous presence of aerobic and anaerobic environments for growth. Facultative anaerobe. Facultative anaerobe, that is the organisms that can grow in both presence of oxygen. Okay, so here it is given based on the oxygen level or aerobic or the conditions of oxygen requirement. The organisms are divided into obligate aerobes, facultative anaerobes, obligate anaerobe, aerotolerant anaerobe, microaerophile aerobes. So obligate aerobes means that only grow in presence of oxygen. And obligate anaerobe means that only grow in absence of oxygen. And facultative anaerobe, that is asked in the question, that can grow in presence or absence of oxygen, but greater growth is in the presence of oxygen. And aerotolerant anaerobes, that can the growth occurs in absence of oxygen, but can also grow in presence of oxygen. Growth is in absence, but can also grow in presence of oxygen. Microaerophile aerobes, that can grow only in presence of low oxygen concentration. Okay, so you have to study the terms and what does it mean, and this example is also important. Okay, so in the non-pharmacology portion, this microbiology is very important. Okay, you have to study all the terms with the example. Examples are very important, like the examples of the examples of different types of bacteria are given. Based on the shape also it is classified there. So each category, the example is also very important. Okay, so you have to study that portion mainly for the pharmacist exam. You have to mainly focus on that examples of each and every microorganisms. Next question, which of the following physico-chemical characteristic of a drug decreases its transdermal penetration? Non-ionic form, high melting point, high concentration, low molecular weight below 500 Dalton, which will decrease the transdermal penetration, which will decrease the absorption of the drug, reduce the transdermal penetration. Which form
Option
of
D.
drug is
Option D.
option?
D, ma'am.
Option B is the correct answer. Option B, high melting point is the correct answer. So high melting point is indicating solid form at room temperature. So that will slower the diffusion. That will decrease the transdermal penetration. And other options like non-ionic form. More absorption is for non-ionic form. So better skin penetration will be there. That will increase the transdermal patches. Non-ionic form will increase the transdermal penetration and high concentration. If there is high concentration drug, there will be greater diffusion and that will increase the penetration. And low molecular weight or molecular weight below 500 Dalton, it will penetrate easily. Okay, so high melting point will decrease the transdermal penetration. Next question, which one of the following is considered as a dangerous abbreviation? CAP for capsule, Q6 hour for every 6 hours, IVP for intravenous push, IU for international unit. Which one is dangerous abbreviation?
Option B.
D, IU for international unit. That is the correct answer. This IU we can read as IV or 10 by mistake. So this is the serious dosing error, mainly for insulin or heparin. You should not write IU for insulin or heparin. You should write international unit. If it is written as IU, it can be read as IV or IV or 10. Okay, it can be misinterpreted as IV or 10. So you should not write IU. Instead of that, you can write international unit. Okay, mainly for insulin or heparin. Okay, so that is the dangerous abbreviation. Next question. A 21-year-old patient went through respiratory depression after receiving anesthetic agent. Which of the following agent will counteract post-anesthetic respiratory depression? Morphine, picrotoxin, diazepam, thiopentol. Which one will counteract the respiratory depression?
Ma'am, option B.
Post-anesthetic.
Picrotoxin.
Option B, picrotoxin. Picrotoxin is the correct answer. Picrotoxin. Picrotoxin, it is a CNS stimulant. It will counteract the respiratory depression that is caused by anesthetic agents by cover all other options like morphine, diazepam, thiopentol. It can cause respiratory depression. So the one that is counteracting respiratory depression is picrotoxin. Defines allergy. A state of immune unresponsiveness where lymphocyte failed to react to an antigen. B, an excessive immune reaction leading to tissue damage. C, the rapid proliferation of immune cells in response to infection. A condition at the cells. What is allergy?
Voice is breaking.
So what is the definition of allergy? Option C, rapid proliferation of immune cells in response to infection. Actually, immune response. That is immune response. Allergy is option A, the state of immune unresponsiveness or to an antigen. That is T lymphocyte or B. So, if the T lymphocyte or B lymphocyte that is become functionally inactive or it is unresponsive to the antigen, that is called allergy. The protective mechanism to prevent autoimmune disease. So allergy is a state in which immune cells, particularly T or B lymphocyte, become functionally inactive and fail to respond to their specific antigen. And it is a protective mechanism to prevent autoimmune diseases by stopping self-active immune cells from attacking the body's own tissue. So it is functional inactive stage of this lymphocyte. Responsiveness of this lymphocyte, and this lymphocyte failed to react with the antigen. Okay. This option D, a condition in which immune system attack the body's own cell. What does this mean? Immune cells attack body's own cell. What is that?
Autoimmune disease, ma'am?
Yes, autoimmune disease. Correct.
Like ulcerative colitis, Crohn's disease.
Yes. Yes. And next question is, a company made profit 1,20,000. The operating expenses were 5,000 and zakat was 8,000. What is the free cash flow? Okay, so the profit is 1,20,000. Operating expenses are 5,000 and 8,000. What is the free cash flow? So how can we find the free cash flow? Free cash flow is equal to profit minus other expenses. Minus other expenses like operating expenses, zakat. So other expenses. So here the profit is 1,20,000 minus expenses are 5,000 plus
8,000.
8,000. So 1,20,000 minus this 5,000 plus 8,000.
13,000.
Yes, 13,000. 1,20,000 minus 13,000. How much is that?
1,07,000.
Option
Yes,
B.
1,07,000. 1,07,000 is the answer. So profit minus all the expenses will give the free cash flow. Okay. This is a frequent question asking for the exam. Okay. Next question. Which cephalosporin has no anti-pseudomonal activity and should not be used in the management of Pseudomonas aeruginosa? Which one is not having anti-pseudomonal activity? Cephalaxin, ceftazidime, cefepime, none of the above.
Alexian, ma'am.
Yes, cephalaxin is the correct answer. Cephalaxin is a first generation cephalosporin. First generation cephalosporin is having the action against gram-positive organism. This Pseudomonas aeruginosa is gram-negative, so it is not effective against Pseudomonas aeruginosa infection. That is, first generation cephalosporins are having no anti-pseudomonal activity. It is only effective against gram positive, not towards gram negative. Okay. And the ceftazidime, cefepime, it is having anti-pseudomonal activity. So ceftazidime belongs to which generation and cefepime belongs to which generation? Cephalosporin. Ceftazidime is third generation and cefepime is fourth generation.
Okay, ma'am.
Which of the following is the most appropriate regimen to prevent constipation in a patient starting on morphine for pain? So morphine-induced constipation can be treated by A. Decussate and senna, B. Bisacodyl and lactulose, C. Polyethylene glycol and metamucil, D. Methyl naltrexone and magnesium sulfate. Option A. Decussate and
A.
senna is the correct answer. So it is the most common regimen and it is the of constipation. Decussate is a softener, and senna is a stimulant. So a softener and stimulant is given together for treating the opioid-induced constipation. So this is the most commonly used drug or regimen. Okay. Next, 62-year-old patient is having heart failure with shortness of breath and pain at rest, no exercise. In which classification of heart failure according to NIHA he belongs to? Class 1, Class 2, Class 3 and Class 4. So this is about NIHA classification of heart failure. So NIHA classification, it is based on the severity of the patient. The heart failure condition, it is categorized mainly based on how much is the physical activity of a patient and the presence of symptoms like fatigue, shortness of breath, by checking that factors, we can classify the patients according to this NIHA classification. It is classified into 4 types: class 1, class 2, class 3, and class 4. Okay. So class 1 means there will be no symptoms. The patient can perform the activities. There will be no limitations for performing the activities and no symptoms. That is class A, class 1. And class 2 means there will be mild symptoms and occasional swelling will be there. Some limitations will be there in the activities and no symptoms at rest. There will be no symptoms at rest. That is class 2. Class 3 means there will be noticeable limitations in activities. The patient will be comfortable only at resting time. Only at resting time the patient will be comfortable. That is class 3. And class 4, it is the C form. Unable to do any physical activity without extremely limited activities and symptoms at rest. At resting time also there will be symptoms. That is class 4. Okay, so here the patient is having shortness of breath, pain at rest. Pain at rest means symptoms at rest. That is class
Class
4.
4.
So this is NIHA classification. A 21-year-old hypertensive man was treated for addiction to amphetamine. He was also discharged on an antihypertensive drug. Later, he presented with severe depression. Which of the following medication was most likely prescribed? After this taking antihypertensive drug, the patient had depression. So, which drug he was taking? Losartan, captopril, methyl dopa, hydrochlorothiazide. Which one can cause this depression as side effect? Which antihypertensive drug? Actually, this methyl dopa. Methyl dopa is centrally acting alpha-2 agonist. It is having side effect of depression because of the CNS action. So, this methyl dopa is not having depression, and if any patient has depression after taking any drug, it can be methyl dopa. Okay, so methyl dopa is causing depression as the side effect. Okay, losartan, captopril, hydrochlorothiazide, these are not causing depression. This methyl dopa is causing depression. Next question, which pathogen is commonly found in pigeon droppings? On pigeon droppings, which pathogen is commonly found? Cryptococcus neoformans, Histoplasma capsulatum, Aspergillus fumigatus, Candida albicans. Which one is found in pigeon dropping or Columba livia dropping? Option A is correct answer. Cryptococcus neoformans. Actually, it is a fungus that is found in the pigeon dropping, and it can cause infection in immunocompromised individuals. Like Cryptococcus meningitis can be caused by this Cryptococcus. We have to discuss a small portion, that is planning in pharmacy. Okay, so planning in pharmacy, it refers to the systematic process of developing strategies and organizing resources to achieve specific goals related to medication management, patient care, business operations. So, the development of strategies, the systematic process of development of strategies is called the planning in the pharmacy. So, for better future of our organization or pharmacy, we are developing the strategies. So, that systematic process is called planning. Okay, so under this planning, we are having different types of planning, that is strategic planning, operational planning, business planning, resource planning, organizational planning, and contingency planning. Among this, strategy planning and operational planning is important. Okay, so strategic planning means it ensures the organization is doing the right things for a long term. So strategic planning is always a long term planning. Okay, you have to note the term long term. Long term means it is strategic planning. Operational planning means it is short term. It will ensure that the organization is performing the immediate task up to date, and it mainly focuses on the short term planning. Short term is operational and long term is strategic. Okay. And business planning means business is feasible, and the operation is it feasible, it is determined by this business planning. It mainly determines the and resource planning means it mainly ensure the resources like human, financial resource, equipments, all the technologies are fully organized or not. That is resource planning. It ensures the resources necessary to achieve the goal and strategy of the organization. All the resources are proper or not. It is ensured by the resource planning. And organizational planning, that will ensure that the organization is well organized properly to meet the future challenges. Okay, that is organizational planning. And last one, contingency planning, it means it provides a fallback option. It is like a plan B. If any of the plan is failing, we can choose the fallback option, that is contingency planning. Okay, so among this type of planning, the strategic planning and operational planning is important. So we can study that in detail. So the strategic planning, only you have to know that it is the planning. The main purpose is to ensure that the organization is doing the right things now and in future, and it is a long-term goal, long-term planning. That is the 2 points you have to know from this strategic planning. And the SWOT analysis, we have already discussed about SWOT analysis. What is SWOT analysis? Strength, weakness, opportunity, and threat. Analyzing all these 4 factors of the business is SWOT analysis. So SWOT analysis is a part of strategic planning. Okay, SWOT analysis comes under the strategic planning, and the fundamental purpose of strategic planning is mission, vision, strategy, roadmap, plan, or tactics. Okay, so that these are the fundamental purpose of strategic planning. Mission means the purpose of planning or the reason for existence. The purpose is mission. Vision means the desired future state. That is the goal of the planning is vision. Strategy means the logic that is applied to reach the vision. So the logic that is applied to reach the goal is called strategy. And finally, roadmap, plans, or tactic is the actions that is taken for this planning. That is plan, roadmap, or tactics. So these are the fundamental purpose of strategic planning. Mission, that is purpose. Vision is goal. Strategy is logic. Plan is action. Last one is operational planning. So it is a short-term planning. It ensures that the organization is prepared to perform the immediate task and the organization is doing the right things or data properly. It is ensured by operational planning. So strategic is long-term and operational is short-term planning.